gonna start oral submucous fibrosis, which is one of the most important topic in dentistry. A patient come with this condition. He or she complains that he cannot open the mouth, that she cannot open the mouth. Okay, so basically in this the overview, basically what happened in the that the submucosa becomes fibrotic. There is a excessive deposition of the collagen fibers due to patients who that take battle coid battles, or they are chewing either areca nut chewing patients, nutrition deficiency patients, genetic predisposing factors have this condition basically. So the patient cannot open its mouth, which is a very characteristic sign of this patient. And there's an excessive deposition of the collagen. Okay, what happens that the patient who takes areca nut or gutka, whatever, it basically continuously irritate the oral submucosa, and due to which, as a protective or as a reaction, what happens, there's an excessive deposition of collagen fibers. Okay, so let's start it. Bismillahirrahmanirrahim. Okay, what happens that it is a potentially pre-malignant condition. So what happens that there is a tendency to become a malignant it has a chances of malignancy. What happens, there's an atrophic, what happens atrophic fibrotic chronic condition of submucosa, that there is an atrophy of the tissue. The tissue becomes atrophic. Okay, there's a fibrotic means there's an excessive collagen fibers deposition, and it is a chronic condition. It slowly progress. Okay, it is an insidious chronic condition, which I've said that it slowly grows, and it involving any part of the oral mucosa, then it extends to pharynx or esophagus. You can see here the ulcer, and the ulcer has a scar band around it. Okay, basically in this you measure the mouth opening, the normal mouth opening, which is actually 45, which is 41 to 45 millimeters, which is the normal. How we measure the mouth opening, it is from the upper maxillary interior teeth to the mandibular central. Okay, so you can see that there is a measuring has been occur. Now moving towards, okay, so always remember, if anyone tells you to describe the picture, you should describe each and everything in that picture. You can see here is an buccal mucosa. Buccal mucosa is present. On buccal mucosa there is a white fibrotic lesion, which has also white. You can see the condition of the oral teeth, which is patient has a very bad oral hygiene, means the, so according to this you will actually make the treatment plan for this patient. Always remember, it is not just that condition. You will also see the overall, that what is also that actually contributing to that condition. Okay, okay, so etiology, basically not well understand, but areca nut chewing is on the top of it. Battle quit, autoimmune reaction. Okay, genetic predisposing spicy foods, nutrition deficiency when B12, so decreased iron resulting atrophic mucosa. So there is a collagen disease scleroderma, which involves the multiple organs of the human of the body. So you have three hypotheses, you can say, of pathogenesis. Number one is areca nut chewing. In areca nut chewing, what happens that arecoline increase the production of collagen. So due to there's an increased production of mRNA protein, so there is an expression of the oral submucous fibrosis. Then you have second hypothesis, which is a flavonoid, yeah, tannin, which is present in petal, which is a collagen stabilizer. It increase the cross linking of collagen, increase the synthesis and decrease the breakdown. Number one is then high, yeah, increased amount of copper in the areca nut, and the increase in copper in the oral fluids regulate the lysolyl oxidase. This lysolyl oxidase is also decrease the production breakdown of the collagen fibers. You have read three hypotheses or pathogenesis, in which there is areca nut. In areca nut there is arecoline. Arecoline, what do it increase the production of collagen. Next you have read about the flavonoid tannin. It decrease the breakdown, and again increase amount of copper in the oral fluids which is present in the areca. It also increase the it also decrease the breakdown of collagen. Then you have the genetic factor, basically by overexpression of the p53 gene. P53 gene was also involved involved in the squamous cell carcinoma. What this p53 gene, what do it detect the defective DNA and does not proceed does not complete the cell cycle. When there is an overexpression or there is any mutation, so basically then there is a disturbance. Okay. Then you have altered human leukocyte antigen profile. Okay, so these are the different alleles, you can say, which is present. What happens in this human leukocyte antigen profile? It is a group of proteins. These group of proteins actually is involved in your immune system. So when there is a disturbance in them, so it is also one of the factor in it. Then you have immunological. Then it is increased levels of cytokines 1, 6, 8. Then tumor necrotic factor, decrease interferon R, so it is anti-fibrotic. Interferon R was anti-fibrotic. When there is a decreased production, so there is an increase in fibrosis. Okay. Then clinical features, basically typically most of the Asian people has this. Northern India, yeah, Bangladesh, 40 to 20 to 40 year more common in females, because you can see there's also females do betel chewing gutka they have. Okay, so what have, and also they take also spicy foods a lot. Painless and having a burning sensation with the spicy food, number one. Patient will have a burning sensation with the spicy food, number one. Then the mucosa will be stiff, white, opaque. It cannot be indented with finger pressure. There is no indentation. Very important point. The thick fibrous tissue on submucosal layer produce a rigid bands via fibrotic bands in the buccal mucosa, which is also in cheeks, lips, and soft palate. So what you have read about the burning sensation with spicy foods, number one, the mucosa is white, opaque, stiff. There is no indentations in the submucosa. There is a fibrotic bands in the buccal mucosa, cheek, lips, and soft palate. Then again, there is a loss of filiform papillae on the dorsal of tongue. Which papillae is lost in them? It is a filiform papillae. Okay, that is effective. Patient has a variable trismus. The mouth opening is 2 millimeter. We have three classifications of them. So it is in class 3 comes basically. Okay, and in severe cases or in advanced case, jaw may be in inseparable, means in advanced case you can jaw cannot be separate. It means leukoplakia of surface of submucosa you have noted actually. Tongue atrophy initially increase the salivation erythema. When there is a tongue atrophy occurs, so what happens? There is an increased production of saliva and increase in redness. Bird shaped vulva is conductive deafness. The bird shaped vulva is a conductive deafness occur. Okay, so we have basically here. So okay, so what you have read about, it was the most important abundant sensation with the spicy foods. No indentations. There's a fibrotic bands on buccal mucosa. Loss of filiform papilla. Mouth opening is 20 millimeter. Leukoplakia, atrophy, tongue have also, and then you have bird shaped vulva, which is a conductive deafness. Okay. Then in histology, what happens? There is a dysplasia found in 13% of sample cases, while carcinoma in 6% of them. Very important. Generally, epithelium atrophy, atopia, fibrosis of submucosa with decreased blood supply. Means on cellular level, there is a dysplasia In the which is also fibrosis of submucosa, there is a decreased blood supply, increased lymphocytes and plasma due to inflammation, and then sub epithelium increased hellenization, which is in advanced stages, basically like a chronic inflammatory reaction in subepithelial tissue. Surface is keratinized or parakeratinized. Malignant transformation is 4 to 8%, 4.5 to 8%, which is very important. It has a chances of the malignancy. Then you have clinical division. You have basically you can say stages or whatever. In number one stage, there's a stomatitis, means there's an inflammation in the oral cavity. The patient will have the erythema, vesicles and ulcers and pigmentation. If the patient has the stomatitis, the patient will have erythema, vesicles or ulcers and pigmentation. Stage 2, what happens? The fibrosis of ruptured vesicles and ulcers. These are when the vesicles and ulcers are ruptured, so they become fibrotic. In early lesion, blanching of the oral mucosa, very important point. Okay, in late lesions, what happened? There is a vesicle circular permeable fibrous band resulting, very again very important point which I want to tell you, that in early stages what happens, there's a blanching of the oral mucosa, but in the later stages what happens, there's a fibrous band formation, which is very important in stage 2. Then you have again the continuity. So what happens, we have also trismus, which I have told you. Then you have a small tongue. Then you have a blanch floor of the mouth, fibrotic depigmented gingiva. Then you have a rubbery soft palate. Then you have atrophic tonsils. Sinking of cheek is due to the loss of the facial and buccal fat through the chronic malnutrition. So what happens is the cheeks become sinking, means there's also it is why, because of the loss of the facial and buccal fat, means that the cheeks become shrinking type, because there's enough fat and there's a chronic malnutrition also patient has. Then you have stage 3. In stage 3, there's a leukoplakia of the 25% in individuals and speech hearing defects. Very important point again. Patient will have a speech because there's a the patient cannot open the mouth. Of course, there will be a speech difficulty. So management and treatment we will discuss in upcoming video. Thank you. If you have any question, queries, you can discuss in the comment section.